Greetings. My name is David Addis, and I'd like to welcome you to our quarterly Global Health Compassion Rounds. The Global Health Compassion Rounds are jointly convened by the World Health Organization's Global Learning Laboratory in Geneva and the Focus Area for Compassion and Ethics, FACE, at the Task Force for Global Health in Atlanta. The purpose of these rounds is to shine a light on compassion in global health with an eye towards further cultivating it in our work. In today's rounds, we'll be exploring the intersection of compassion, religion, and global health. Many of our colleagues in global health cite personal faith as a fundamental motivation for their work in global health, but we don't often speak about it publicly for many reasons. Our hope is that by exploring and understanding the role of religion and religious faith in motivating and sustaining individual compassionate action, we will be better able to cultivate compassion more broadly and effectively within our field. Now, our assumptions about compassion influence our ability to cultivate it. Dr. David Schlim has noted 4 different but not mutually exclusive perspectives on the source of compassion. Where does it come from? It could be a product of evolution, something that has perhaps a genetic basis. It could be acquired through one's upbringing, through good child rearing practices. Compassion could also be an intrinsic quality that's naturally present as part of our minds, but needs to be cultivated through practice. And this is a view that has a lot of backing and support in scientific research today. But a 4th idea of the source of compassion is that it comes from God and is cultivated through religious faith and religious practice. This is the hypothesis, you might say, or the idea that we'll be exploring together today. The role of religious faith in motivating or sustaining compassion and its influence in global health. We won't be addressing some of the larger issues about how religion and public health interact, but rather focusing on how faith motivates and sustains individual global health practitioners. At this point, I'd like to turn it over to my co-host, Dr. Shams Syed, of the World Health Organization. Shams?
Many thanks indeed, David, for those important framing remarks. I'm really very glad that we're exploring the role of faith in cultivating compassion in global health. And that has to be done in a spirit of open learning. It's an important area, not without controversy. And that is exactly why we need to learn together on the subject. So 3 quick points from my side on why this exploration is so important to health services. First, faith-based or faith-inspired organizations and providers are an important contributor to healthcare across the world. So estimates vary widely, but it's clear that a certain percentage of services are organized and delivered by faith-based organizations in many countries. And how faith cultivates compassion in these settings is really important to explore. Second, as highlighted in the Lancet series on faith-based healthcare back in 2015, and I quote, understanding of the characteristic nature and quality of services provided by faith-based health practitioners is crucial. And for me, this warrants attention to all domains of quality health services: effectiveness, safety, people-centeredness, timeliness, equity, efficiency, and integration. Olivier and colleagues go on to highlight in this Lancet piece, and I quote, that in many of the available studies, the quality of the services provided is perceived as high because of a particular attention paid to the dignity of patients, sometimes articulated as more compassionate care than received elsewhere. And then the authors go on to assert that this comparison of quality of care is poorly substantiated, as are its drivers or causes. And this again points to the need for focused learning on how faith cultivates compassion and how that links to quality of care. Third, let me turn to the point of care. For healthcare providers in any setting, and whether that's faith-based or not, faith can certainly be a strong driver of compassionate care, which in turn has close linkages with quality of care, which we've explored in previous global health compassion rounds. And this has become clear and evident in the current COVID-19 context, in the millions of human interactions taking place between a health provider and patients across the world. So how does faith influence compassion within this point of care environment? How is it related to the culture of quality in a health setting? That's the glue that holds things together in any healthcare environment. And these are questions that require active exploration. So it's for these reasons that I'm so pleased that we are having this Global Health Compassion Round. Look forward to listening carefully to colleagues from across the world and to learning. And what emerges from these discussions can certainly inform us all on how we move forward with our efforts at all levels of the health system. So thank you, David, and back to you.
Thank you very much, Shams. Appreciate those comments and that framing for us today. Let me just give you a sense of the journey we'll be taking together today as we explore this theme. We'll first be hearing from Rabbi Alon Goshen-Gottstein, who will provide some reflections on compassion from his own tradition of Judaism, with some additional comments on world religions. And I'll introduce Dr. Goshen-Gottstein in just a minute. We will then hear some personal reflections from two global health leaders, Dr. Gilbert Buckle from the Christian tradition and Dr. Babar Qureshi from the Islamic tradition, speaking on the role of faith in their global health work. This will be followed by a deeper exploration about the shared values of compassion that facilitate the relationship between St. John of God Healthcare, a large Australian NGO, faith-based NGO, and the National Hospital in Timor-Leste. We'll have a panel discussion following these presentations, and we welcome your questions and comments. Please use the Q&A box to ask your questions. We'll be monitoring them. And also please feel free to use the chat for chatting and exchanging ideas as we move forward together. Now, to help ground and orient our discussion about religion, compassion, and global health, I'm delighted to introduce Rabbi Alon Goshen-Gottstein, who joins us today from Jerusalem. Dr. Goshen-Gottstein is one of the world's leading figures in interreligious dialogue. He founded the Elijah Interfaith Institute in 1997 and has served as its director ever since. The Elijah Interfaith Institute brings together world religious leaders at the highest levels for deep dialogue and practical interfaith initiatives. He also brings religious scholars together to ponder the meaning of the scriptures and to challenge each other and to explore the texts together. He's written many articles, many monographs, and has a series on interfaith studies that has also been published. I encourage all of you to visit the website of the Elijah Interfaith Institute, which we will post in the chat, as well as another link within the Institute, a series of discussions with world religious leaders on COVID-19 pandemic, which Alon calls this the Corona Spection Media Project. So Alon, thank you so much for joining us today. I look forward to what you'll be sharing with us.
Thank you, Dave. It's good to be together. We've traveled many years together, many institutions. And I'm honored and frustrated by this invitation. Honored, because obviously I'm honored. Frustrated, so it goes as follows, why I'm frustrated. David, you tell me that you'd like me to offer some framework that would provide meaning for people working in the healthcare, not just hands-on, but policy, international, to speak on behalf of all religions in 10 minutes. So what response can there be to that but frustration? I'm reminded of a Talmudic story of a potential convert to Judaism who came to the great patriarch Hillel, 1st century BC, important figure. And he says to him, teach me the entire Torah while I'm standing on one foot. So this notion of trying to encapsulate something, coming to the core while standing on one foot. Hillel tells him a version of the golden rule. Don't do unto others what you wouldn't want to have done unto yourself. So that's like a distilling of the entire teaching. He says the rest is commentary. So this is a challenge that the tradition already has met. You know, if Hillel were invited by you to a session, he would be told, give us the entire Judaism on Zoom in 90 seconds or less. And then he, because he's a great sage, he succeeds in formulating that. But I'm not a great sage. And not only that, but I'm asked to give a talk on the essence of compassion in all religions in 10 minutes or under. So no wonder I'm frustrated. So what I've chosen to do is to offer a certain key insight from Judaism and then build out from that insight to other religions by putting forth a challenge, a view, a perspective. And we all realize that anything I say is going to be fundamentally inadequate. So I'm going to take my cue from an 18th century Hasidic master. Hasidic means a member of the spiritual revival movement that took part in Judaism from mid-18th century down to today, a very powerful movement. And the figure is called Rabbi Nachman of Breslov. I'm going to put his name in the chat so you can Google him. I already put in the chat earlier the URL for the Corona interviews. We did a series of Corona interviews with 40 religious leaders, which then also eventuated in a book, which could be, of course, relevant for health practitioners to see how religious leaders engage the issue of Corona spiritually, reflectively, pastorally. So the link is coronainspection.org. I just put the name of Rabbi Nachman of Breslov for people who would like to Google him. And I'd like to begin. I'd like to share two quotes from him, and then move from those two quotes to broader considerations that relate to other religions. So the first quote comes from Teaching 64, and Rabbi Nachman says the following: the principle of creation was for the sake of his, in other words, God's compassion. For in everything that was created, there is contraction, in other words, a manifestation of his compassion. God created this specific thing in the particular form and image it has in accordance with his compassion. For his compassion, blessed be he, necessitated that this matter will be so. Because compassion is the root of all creation, for everything was created in order to manifest his compassion. So this is an outstanding statement. We tend to think of compassion as, going back to those educational motivating forces that Dave just spoke about earlier, as a kind of value, a virtue, something that belongs in the field of education. And here we discover something where compassion is something to do with metaphysics, with ontology. It's in the ground of being. God creates the world for the sake of compassion, and his design is informed by compassion, not only in the big scheme of things, but down to every little detail. In other words, when you look at life, you see compassion manifest. Whoa, now that's a big statement. We don't see that. We don't see how compassion is lived in action. And in fact, Rabbi Nachman goes on to bring forth another statement that captures just this particular tension of how universal it is, and yet you don't see it. And he makes a second statement. This appears in teaching 105 in his collection of teachings called Likutei Moharan. He says, everyone asks for compassion, everyone seeks compassion and does not know where it is. And compassion is present before everyone's eyes. As it says, it is not far, it is not in heaven. So he takes a verse from Deuteronomy, and he, as far as I know, for the first time in the history of Jewish interpretation, applies it to compassion. And he's saying, compassion is ubiquitous, it's omnipresent, it's everywhere. We simply do not see it. So compassion is woven into the fabric of creation. And therefore, we need to discover the divine compassion that is in all creation. And this becomes a process of a conscious effort to uncover that which is in reality, but is hidden from us. And compassion then becomes a guiding force for all that we do, how we live our lives, and how that is being managed in detail. This is a very far-reaching principle for grounding compassion. So I offer this as an insight from which I then want to open up. This is the equivalent of my teaching the entire Torah on one foot. Okay, so this teaching of Rabbi Nachman is the equivalent for that. Now let me open this up then to further consideration and to ask, so what can we learn from this that is relevant about religion more broadly? Well, I'm not actually familiar with the teaching of another religion that says the same thing, but I am familiar with many ways in which religions take the notion of compassion and they ground it in the broader structure of reality as they understand it. Let me illustrate this, for instance, from the case of Hinduism. Many of you will have heard of the Ramakrishna and his great disciple of the beginning of the 20th century, Swami Vivekananda. So one of the key notions of the metaphysical system, which for simplicity's sake, we will say Advaita Vedanta, though it's quite possible that the system, the philosophical system has to be nuanced, and it's not exactly that. One of the great elements in that particular system is the notion of the unity of self and others. So we have to discover the fact that our self is the divine self, is the same self that is in everything. So Swami Vivekananda takes this particular notion, and he takes what is essentially a philosophical notion, and he pitches it in the direction of a moral principle. And he says that, or he teaches that, to see the self in all is to practice compassion. In other words, it's not enough to just make the point metaphysically that I and you are one. But if I and you are one, how does that translate in moral terms, in terms of social action? And the answer is compassion. And that in turn then leads to a very activist, and in terms of Hindu movements, it was a very early activist movement where the Ramakrishna mission has a strong social action program globally based on its metaphysics. So here's another case of how metaphysics lays the ground for the practice of compassion. And I could multiply this for each religious tradition, but I'm mindful of the fact that I'm supposed to speak 10 minutes or more. So the notion of compassion for the two systems I just indicated, as well as for Islam, whose Fatiha, the opening statement of the Quran, appeals to God, who's the all-merciful, as well as Buddhism, that makes compassion and overcoming suffering a cornerstone of its own structures, and so on and so forth for every religion. Compassion will never exist as a free-floating value. It will always exist grounded in broader metaphysical, consciousness-raising structures. And that, therefore, amounts to an interesting theoretical challenge and an interesting practical call. The interesting theoretical challenge is as follows. And I don't know the answer to that. This is something that has to be researched. Maybe someone has done it. I'm not aware of it. Do religious traditions that approach compassion from a ground of a theoretical infrastructure and that cultivate compassion through broader religious practices, grounded in wisdom, grounded in a view of reality, where the outcome of those wisdom practices is compassion. So do these religions equip their practitioners better to practice compassion? In other words, if I go on a medical ward or if I'm setting policy, will the person who draws his inspiration just from being a good human person be less empowered than the person who applies compassion based on a more spiritual grounding? I think it's a fascinating question. It really goes to the heart of why we're having this particular round. And I don't know how to answer it, but it's a question we should put on the table. My hypothesis is that certainly in many cases, because I don't want to be universal about this, because I don't want in any way to be seen as putting anyone who doesn't have religion down. But my hypothesis is that religion empowers you to practice compassion in a fuller way, because it doesn't simply try to bring out good behavior or try to cultivate feelings. It grounds these in broader structures of meaning and of wisdom. And those structures of meaning and wisdom will ultimately provide greater resilience, power, depth, empathy, energy, whatever it is that you need to practice compassion more fully and more effectively. And therefore, whether or not the future study will yield unequivocal data regarding the benefits of a religious worldview to the practice of compassion, there's no doubt that the individual person stands to gain much by drawing on the metaphysical and spiritual principles of religion. However, I think part of their success is that they're not done sort of smorgasbord style, let's pick up an idea from here, an idea from there. It's good to know that Rabbi Nachman teaches this. It's good to know that Swami Vivekananda teaches that. But for the person to really grow and to cultivate compassion, of course, it requires a more disciplined, systematic approach to the spiritual life that can bear fruit. Okay, getting inspirational ideas is good. Having a full training that really opens the heart and trains a person to be an agent in the execution of compassion is even better. So my message on one foot, and my second foot is really, my foot is really getting tired. It's time to put the other foot down. My message on one foot is compassion is grounded in wisdom, is grounded in a totality of a worldview. We've had little taste of what that looks like from one teaching. What religions offer us is the depth that empowers us to practice compassion through wisdom and the totality of the transformation of a person that in turn allows compassion to flow. Thank you very much.
Hello, and thank you so much for that. It was really wonderful sort of tour de force, and you raised, I think, what is the essential question. And I think we'll be hearing at least some reflections of the personal response to that question in the lives of our next two speakers who have provided video reflections, and then also later on. So it's a theme I definitely would like us to come back to in our conversation. So thank you so much for getting us off on a really stimulating and challenging start. Our gratitude to you. For personal reflections on how faith nurtures and sustains compassion in action in global health, we turn to two global health leaders, and we'll hear some video recorded messages from them in response to some key questions. The first is Dr. Gilbert Buckle, who's a public health physician in Accra, Ghana. He's an expert in health system strengthening and in this whole idea of improving quality health services. He's been executive director of the Christian Health Association of Ghana, and before that, the executive secretary of the National Catholic Health Service in Ghana. Also on the video is Dr. Babar Qureshi, an ophthalmologist and director of the Neglected Tropical Diseases and senior medical advisor for CBM, Christoffel Blinden Mission, which is a Christian NGO. Dr. Qureshi was born in Pakistan but raised in Nigeria, and he did his medical initial ophthalmology training in Nigeria. He's a global health leader focusing on prevention of blindness, particularly the disease trachoma. So let us listen to their reflections, and then we'll come back in to continue our program. Go ahead, Ashley.
as a child, I have been brought up in a Muslim family in rural parts of Africa, where my parents worked. And there was always this big value in the house that you treat everyone as you would like to treat yourself. And I think it became quite obvious to me as I grew up how this was practiced at home. That's where probably the roots of compassion started with me. And that was probably mixed with other things. That can't be the only reason that I went into the whole field of medicine.
Compassion for me is beyond empathy. Empathy, for me, practically is, can I put myself in your shoes to understand where you come from? Compassion is, can I put myself in your shoes and feel what you feel? And that's, for me, is a whole world of difference. So compassion is feeling the other person, not just understanding where they're coming from, not just doing the logic of, well, okay, I can see where you are, I understand you're sick, I understand you're in pain, but can I feel the extent of the pain? Can I feel the extent of your discomfort? Can I situate myself to that extent to actually feel what you're going through? And that for me is compassion. You know, all the issues of quality we talk about, you know, patient-centeredness, equity, you know, they're fundamentally heart issues. And I tell myself and colleagues that you need to be authentic in the quality space. You cannot deny your faith, you cannot deny your beliefs, you can't deny it and pretend that patient-centeredness, pretend that, you know, the common humanness is just a piece of English language. You have to feel it. It sounds wishy-washy if you detach it from the human person. So it's challenging to speak to it as if it's a theory, as if it's an academic piece of theory. No, you must let people authentically relate to it and let them find areas in their lives and other spheres of their lives where compassion has kicked in, where love of neighbor has kicked in. And words like that, we shouldn't be shy about it because it's a people issue. It's not a technical skill, it's a people issue. And people shy away from it. But if it's presented as a people issue, it has nothing to do with, forget about Muslim, Christian, professor. At the bottom line, how would you want to be treated? And people get stuck in answering that. But we shouldn't be shy about naming it. It's about loving the guy next door. It's about being selfless. You know, it's about being a good person, whatever good means. But we need to use those words. We need to not let people be shy of it. You know, we need to. If not, people dissociate in their minds the technical work from the heart work. And we need to bring the two together. It is what it is. You cannot do compassion or quality without your heart. It's just not possible. You know, we started out working and these were not the questions we asked ourselves. It was very technical. You do the numbers, you do the work, and it's about the work. And then as we matured in the space, it ceased to be about the work. You see the real impact that you do on people's lives. And it's humbling. From the faith, it's a humbling experience to realize that I have that much power in my hand as a health worker. And I want to be paid as a health worker. I will make the diagnosis, I will treat, I'll make suggestions, people will listen to it, lives will change. I mean, that's absolutely raw power. But my faith humbles me to realize that that's a gift. It's a gift of God. You know, and then my faith tells me, hey, you know, let your God in heaven take the credit for what you do. So all these things are humbling. It allows me to do my work without wondering whether people are going to appreciate what I do or not, whether people are going to acknowledge me or not. I just get out and do my best. And when somebody says, God bless you, I'm like, God, done it. They've acknowledged that there's something bigger than myself. You come to the point where you realize that it's not about you. It's not about you. It's much bigger than I am. And I'm just grateful that I can let somebody say thank you and say, God bless you, and make sure that, yeah, there is something bigger than myself. And for me, that's what keeps me going. So whether it's at midnight, whatever it is, I am just one of those in the vineyard of the Lord, and I do my best.
I come from a Muslim faith, and if you study the Muslim faith, actually compassion is a very integral part and pillar of the whole religion itself. So it's not only about the value of religion, but it is ingrained in the whole religion or the practice of religion as itself. In fact, now that you talk about it, each time we start anything, to read the Quran or read any piece of the Quran, we always start with the name of Allah. And the first word is the compassionate. And then the second word is the merciful. And if that's the kind of emphasis sort of on it, I think it sort of runs through the sort of whole religion itself. And I'm sure, now looking at hindsight, that my family was driven by this. And then they inculcated in their children the whole concept. That's one part of this. So the second part is, how does it influence my work? I think it's come to a point where it's so much part of me that I really don't consider it religious anymore. I think it's a human duty. It's my duty as a human being to be compassionate. I can't see it otherwise. And then if I say I draw the inspiration from my religion, yes, that is true. But I think it has a much broader implication now.
At the root of all the faiths, it's exactly the same. There's no conflict of faith. There's no conflict of faith in the efforts to do good, whichever way we understand good to be, to meet the expectations of the patient or the other. It's exactly the same. Whether it's a Muslim, a Buddhist, whoever we meet on the ward, there's never a conflict faith-wise. There's never a conflict in terms of how we care for the patients, how we manage them. You know, what happens is the separation of faith in the secular world and what we do, only to realize down the line that all these issues of quality, of the shared humanity, it's all in faith. But at the end of the day, it sits in our guts. It sits in everybody's gut, what is right and what is appropriate. Yes, we rationalize it from a secular perspective. Why should I go the extra mile? Nobody's paying me for this. Why it's time to get off my shift? Why should I stay another hour? Let the nurse coming in do the work. You know, we rationalize it. But I dare say when we leave after the rationalization, it hits us all. It's hit me enough time to know that don't waste your energy to rationalize. Just do what your gut tells you and then move on.
It's a very, very interesting question because I've been asked this all my life. I have now worked for an organization that is of the Christian faith for about 24 years. And I believe that it's got to do with a lot of understanding, a lot of tolerance, and above all, shared values and vision. At no point in time in these 24 years, there has been a conflict at this particular level, which is what matters to me. And that is the cause for which I work. That is preventing blindness. I have never had any conflict, neither spiritually nor ethically, with the organization ever.
As we matured in the work and we matured in faith, there's a calm, there's a humility that goes with the work that we do. There's an appreciation, of the dignity of the person you're managing, the dignity of the person you're treating. They're different only insofar as their skill set. But in the eyes of the Lord, they're exactly the same. And I'm motivated to treat them as I would want myself to be treated. But it's about how do I make sure I respect the dignity of the person standing in front of me. The other thing is, the Bible tells you a time will come and Jesus will say, we'll be telling, Lord, I know you, Lord, I did this for you. And he will ask you, when I was thirsty, did you give me water to drink? And I will ask him, when did you tell me you were thirsty? And he will say, you know that guy who passed you 5 days ago, who asked you for water and you dismissed him? That was me. So to put it frankly, we're probably totally scared that the guy in front of you just could be Jesus. What if this was the one Jesus sent? What if this was Jesus himself? And it's gone beyond doing it because of the expectation that, hey, you're going to pass the test. Now it's just become a way of life, a perspective one has, a framework one uses in managing and doing what we do all the time. You see, the shared humanity is the dignity of the human person. We were all created in the image and likeness of God. He created us male, he created us female. But we're all fundamentally created in the image and likeness. That is the shared humanity. Classic example. There were days, again, when one was in the clinical space, we were just dead tired. You could barely open your eyes and you're walking around emergency. And we knew that other hospitals had shut down. This is the only hospital that is working. We knew our shift was over. But you ask yourself, if you leave, who is going to do what needs to be done? At the end of the day, for me, in those very difficult situations, they are very difficult and trying situations. There's risk of infection, there's risk of many things. And you ask yourself, why am I doing this? Why would I put myself and my family and everybody in jeopardy? But at the end of the day, your heart kicks in. Your heart actually kicks in. And you're like, you know what? Yes, I could get infected. Yes, I'm dead tired. Yes, I could leave and nobody would hold it against me. But you know what? Hey, let me do my best. Let me just do my best and know that I did my best. And whether you're an atheist, whether you're a Christian or Muslim, the heart kicks in and keeps you there.
Thank you so much, Gilbert and Babar, for those really profound remarks and for sharing with us your perspective on this embodiment of faith in your work. And we look forward to coming back and invite you both, if you're able, to join us for the discussion. We'd like now to take a more focused look at faith faith-based NGO in Australia, of St. John of God, to explore how faith-based values can influence and motivate compassionate action at organizational level and practice. And this is a collaboration really between the St. John of God and the National Health System, National Hospital in Timor-Leste. First, we'll hear from Ms. Anthea Ramos, who's the Social Outreach Director for International Health at St. John of God Healthcare. She started her career as a medical research scientist, but now oversees St. John of God's international health programs, including those in Timor-Leste. So Anthea, thank you so much for joining us. We look forward to your presentation.
Well, thank you. Thank you so much. Are you able to hear me?
Yes, yes,
Lovely.
loud and clear.
I'm just going to share my screen with you. You should be able to see my screen.
I'm not able to see it yet.
Let's see. Wonder why that's not sharing. Okay, perhaps I'll just talk then if I can't share my screen.
Anthea, would you like me to share the screen and you can just tell me when to advance the slide?
Great, thank you.
Absolutely,
Thanks,
one
Ashley.
moment.
Great, we can see it now.
Thank you. Oh, lovely. First of all, I'd like to say thank you so much for inviting us, and you've described it as a collaboration, David, between St. John of God and the Hospital Nacional Guido Valadares in Dili in Timor-Leste. And what I'd like to expand on that is say that it's actually more than a collaboration, and it's actually a synergy that we've found between our two organisations. And I'm really glad to be able to share the experiences that we've had, because we can talk a little bit more about the practical things that we've put in place. And Lolita, who's going to speak after me, will be able to tell you a lot more about the practical things that she's put in place. If you could go to the next slide, please, Ashley. So first, a little bit about our organisation. We are a Catholic healthcare organisation. We run hospitals in Australia, as well as disability and outreach services. And the work we do in Timor is part of our outreach service, and it's based on the principles of capacity building. So we're not providing any kind of clinical service in Dili. We are building capacity. Our founders were the sisters and the brothers of St. John of God, and they worked with the most vulnerable people in their communities. And their work was inspired by San Juan de Dios, or St. John of God, who cared for the most vulnerable people in Granada in Spain in the 16th century, so 500 years ago. Our vision, our mission and our values are very firmly embedded in our organisation and are visible in all parts of our facilities, and they're included on our documentation, and that they're always at the forefront of our work. We commenced our work in Timor in 2004 and have been primarily involved with the hospital since then. We do also have one very small program in Papua New Guinea. We are really primarily concerned with supporting the hospital and other hospital facilities in Timor to improve their patient care. We equate compassion with patient care, and in particular, we're concerned with the experience of the patient and the experience they have during the course of their care. And we do this with the hospital in Dili, both through support of the hospital and role modelling of our team. So we have a team in Dili of about 22 or 25 people, and all of those caregivers are role modelling all the time. Next slide, thanks, Ashley. We are a faith-based organisation. We're a Catholic organisation, and our work in Timor, and in fact our work throughout our organisation, is based on our Catholic tradition. We believe, as Gilbert said, that serving the patient is serving Christ. The Good Samaritan parable is a very familiar story to us, and we take Jesus' instruction to go and do likewise as a clear instruction for how we do our work in our organisation. The focus on dignity of the patient comes from Catholic social teaching, and we talk about the head, the heart and the hands. So knowing is good, feeling is better, but doing what is needed is the act that is the act of compassion. And that really is the key. And I think Gilbert also talked about that. At the end of the day, when you're tired, you still have that act of compassion. Our organisation actually invests in our caregivers, our staff, and particularly in leaders by providing us with really extensive formation opportunities. This provides us with ways to align our own personal values and our faith values with the values of our organisation. In Timor, we invest in our team of more than 20 caregivers and have a mission formation group that provides leadership and support for our caregivers there. So we're always constantly reviewing and revisiting our vision, our mission and our values. So in doing our work in Timor, we're extending our faith-based principles to our work there. And I would like to sort of express that by just saying, this is just who we are as an organisation and as caregivers within that organisation. Next slide, thanks, Ashley. We started the journey with the Hngb about a decade ago on their road to compassionate care. When we first commenced the nursing development program in 2010, we really noticed a gap for the nurses and the midwives in their priorities for patients. When we talked to them through forums or through surveys, we found that fewer than 20% of nurses and midwives actually mentioned the patient when we asked them, what are your priorities? Lolita's going to talk a little bit more about this in her session. So we commenced a sort of a side plan to support this gap. And I say a side plan because it wasn't really articulated in our objectives for about another 6 years. Some of the activities that we have done with the hospital have included promoting leadership for the nurses and midwives by advocating for the appointment of a director of nursing and midwifery. And in fact, we advocated for Lolita to hold that position. We had been working with Lolita for about 5 years at that point, and we saw her as someone who could really take the hospital forward, and particularly nurses and midwives. Lolita was in fact appointed to that position, and we then worked with her by drafting an individual development plan, which included for Lolita a trip to Australia to come to one of our hospital facilities and have the opportunity to really see what compassionate care looked like in a real setting, in a hospital that showed great quality and great leadership with respect to patient compassion, patient care. We also supported the hospital to make its vision, its mission and its values more visible. So we promoted it through posters, through including their values on documentation and providing training in the areas of vision, mission and values through the professionalism work that we've been doing, the leadership work. We held values days for our shared values. The Hngb and St John of God have two shared values. We share the values of excellence and compassion. And we developed a health manager program because we realized that there was actually a gap in the ability for managers to recognize the leadership value of actually embedding values into their care on a day-to-day basis, and we role modeled. I want to talk a little bit more about the values day. So Ashley, if you wouldn't mind the next slide, thank you. we held two values days we held one in 2016 and we celebrated the value of excellence. And in 2017, we celebrated the value of compassion. Those were the two shared values that we had with our organisations, as I mentioned. The Values Day that we held in 2017 was the compassion value. And what we did was we created a poster or a large banner with a tree on it, and we called it the Compassion Tree. And we then invited all of the managers in all of the wards to sit with their staff and ask their staff, what does compassion mean to you? And these cards came back with the managers. We invited everybody up to have a celebration with us. And we asked the managers to share with us what exactly it meant for them and their staff to feel compassion for patients. And you can see in the photo there, the managers sharing with us all their thoughts and the compassion tree there. And if you just move to the next slide, please, Ashley. You'll see this word cloud. These are the words that were included on that compassion tree. And you can see very large patient care. So we started to see in 2017 by asking the question, what does compassion mean to you? These were the answers that we got back. And I think this goes to Gilbert's comments and some of the other comments about using the language. So the language was explicit and we were asking, what does compassion mean to you? Which actually started a conversation. And it was a very valuable day indeed. It was, in fact, it was the first time I'd heard nurses talking about patient care. And I'd like to also mention that the two values days that we ran in 2016 and 2017 were the only values days we ran, because in 2018, Lolita and her team came to us and said, you don't need to run this for us anymore, St. John of God, we're going to do this ourselves. And I think that was probably one of the best pieces of capacity building that we've been able to do, was certainly handed over within 2 years, and it was incredibly successful. And Lolita will talk a little bit more about that. And for me now, it's over to Lolita.
Thank you very much, Anthea. That was really a wonderful introduction and very helpful to see how you embodied some of these principles in practices that gave voice to the compassion that was there and also nurtured further compassion. I'd like now to introduce Ms. Lolita Diarajo, who's Director of Nursing and Midwifery at Hospital Nacional Guido Valadares, which we may refer to as HNGV, which is Timor-Leste's national hospital. Lolita has nursing degrees from Timor-Leste and Indonesia, and in recent years has focused on education and leadership development in nursing and midwifery. And as we've heard a brief synopsis, she's working to develop a culture where the patient is at the center of care, a compassionate culture. Lolita will be assisted by Favi Silva as local stakeholder engagement manager for St. John of God. Ms. Silva works to build and maintain relationships between Timor-Leste and St. John of God, which is an increasingly important role amidst the COVID-19 pandemic. So Lolita, please, the floor is yours.
Thank you very much for the opportunity. Good morning, good afternoon, good evening to you all. It is an honor for me Can you see my slide?
Yes, it's good. If you could make it the screen, make it there, that's it. The slideshow, then we'll be all set. Well, there we go. Beautiful.
Okay. It is an honor for me to share my experience about compassion in the context of patient care. It has many challenges to implement in Timor-Leste. As you know, my country is a younger nation in Southeast Asia. We have been independent for 18 years. In human terms, Timor-Leste is only a teenager. As part of the younger generation, I have responsibility to continue our nation dream for a better life, especially with the knowledge that many of our people have sacrificed so much to regain nationhood. And for us to continue to build the nation that many who want it are no longer with us, to witness the fruit of suffering. Although compassion is always available in families, in family groups, our nation history make broader compassion a bit hard for most people. Next slide. I work at Hngb since 2002. One nurse and one doctor for each shift. We attend 200 until 300 patients at 300 patients a day in emergency department because of no choice as no other hospital. Hngb is the top referral hospital in Timor-Leste now. It is the only teaching hospital and it offers the highest level for secondary and tertiary healthcare in Timor-Leste. Hospital-based training for the nursing cadre is led by senior nurse and nurse educators with support from St. John of God. We are lucky to have St. John of God as our partnership. In 2015, our executive director at the time expressed the terms excellent in service, commitment, compassion, and knowledge, which is incorporated in the internal regulation of Hngb. It is the foundation to start our dream for better patient care and improvement quality care. I now understand and agree with many that compassion has best benefits for the patient. What has influenced compassionate care at Hngb? First, we teach our staff that we must recognize that the patient is not someone else. They are our children, our family, our father, our mother, our grandparents, so they are our family. The Timor-Leste culture is family, building around family. Therefore, we emphasize to staff that we must have responsibility to provide the best care we can do for the patient, our family. How do I change attitude and behaviors in our staff in order to be more compassionate? Senior nurse and midwives, including myself, learn a lot from individual professional development plan. From education, training meeting, workshop, seminar, and visit other hospitals. When I learned all of this, I began to be curious. How can I make my hospital to be similar like others? I was fortunate to have experience at St. John of God Geelong Hospital, when I saw many new things, and compassionate care given to patients. I saw how nurses behave a compassionate way to their patients at work. I start to understand better about standard for attitude, and I listened to their explanation that this is basic for the nursing and midwife to improve professionalism. I stop a while and think how and where to start for Hngb. When I return from Geelong, I have priorities. One of them was developed as a code of conduct for a nursing and midwife. Upon my return from Geelong, I start to gather all head of department, nursing in charge, educator, to seek their thoughts on how to realize the code of conduct. The code of conduct for nursing and midwife was developed in 2019. My team made presentation of the code to senior staff, the executive team, and other stakeholders. We socialized and talked about it in many events, such as training and workshop, and we make it visible in every ward. Now, all newly recruited nurses must receive orientation and understanding of the code of conduct at the commencement of employment. However, opportunity present, we talk about the attitude and to patient and at meetings such as morning report, unit meeting, and nurse and midwife council meeting. It is not easy to be compassionate when staff are overworked, so we do persistent opportunities remind of staff about compassion during given care, employ more nurses to share workload. In order to make change, we understood and make leadership a key part. Therefore, we established nursing and midwifery committees, and from here, raise awareness from all members on the policies and SOP. For me, this is a momentum to improve nursing and midwife work. So it was easy for us to develop policies and SOP because everyone has the same understanding for the importance of SOP. We are also having a program supported by St. John of God called Health Manager Program Training. We are very fortunate with this program because it can improve our ability, our confidence, and support us to initiate ideas for patient care. How do we know compassionate care is happening? Number one, we observe our staff doing work and we remind them about compassionate care. I'm happy to say that more and more of our nursing show compassionate in their care. Number two, anecdotally, many people say that experience with us that our care is improved compared many years ago. We invite patients to share their experience on Hngb Values Day, and we receive the same comment that our care has improved. Number three, survey. Hngb had independent survey used the IVC tool in 2014 when we scored 5%. This has increased in the next three surveys to 32% in 2020. This number might be small for some of you, but for us, this is a significant number for improvement. Other evidence is patient experience survey show good improvement of 87% in 2020. When I socialized code of conduct, I began to see the light from nurse and midwife question and answer so that they all have awareness for improvement. You can see the data from the survey of nurse and midwife attitude to work in 2010 and 2020. In 2010, the results showed that many staff only came to work just to do a job. However, in 2020, survey results show that they have realized that they are at Hospital Nacional Guido Valadares for patients. Therefore, they must have responsibility for patients. Usually the word we use for them that patient is the Jesus and Jesus is our God. That's why we have responsibility to take care of him. Please take a look at this chart. The result of recent nursing and midwife survey show that 75% explicitly mention the patient, 17% alluding to patient, and 8% no mention of or alluding to patient, but they are talking about professionalism. This photo to show our activity for Values Day in 2019, which is attended by Vice Minister of Health, General Director, Member of Parliament, WHO, patient, priest, and all Hngb staff, but we only do a similar Values Day in 2020 due to COVID. So we just had a mass and patients share the experience with us. For me, making people healthy and keeping people healthy is my small part in helping to build our nation, because healthy people equal healthy nation. It is my great desire that Timor-Leste nursing and midwifery Hngb continue to improve so that our people do not miss out on excellent patient care. That's all from me. And thank you very much for your attention.
Thank you very much, Lolita. That was really a wonderful description of how you have taken these core values of compassion and really incorporated them through policies and practices into an organizational structure and the organizational life. So you've transformed this culture. And I think that's one of the biggest challenges that we in global health have, is moving from the sense of personal compassion to creating compassionate systems. So thank you very much, both you and Anthea, for that wonderful example of how this might be done. I'd like to invite Shams Syed now as my co-host to join, but I'd like to begin also by asking any of the panelists who have participated to respond in a sense further to this challenge or this core question that Rabbi Goshen Gottstein posed, the metaphysical framework or understanding of compassion that a religion or a spiritual framework provides. How do we move from that to embodied compassion in action? And how does that connection work? How is it sustained? We've seen some wonderful examples of that embodiment, both at the individual level and also now at the organizational level. And I'm curious to explore that a little bit. So any of the panelists that would like to respond, please do. Dr. Buckle, Gilbert, we also invite you to join the panel as well. Alon, your video is on, so I'd like you to start us off, please. Yes.
Thank you, Dave. Thank you to all the contributors for very rich presentations. I'd like to make 2 points that came to me as I listened to our two speakers, Gilbert and the friend from Pakistan whose name I do not recall.
Babar.
What they basically showed, Babar.
Yeah.
So what they basically showed is how a spiritual training becomes part of yourself. Babar said, it's no longer religion, it's part of me. And if I can offer a little pun on what Gilbert said, it worked very well with his accent. So with the similarity between the two terms, it's from guts to guts. So it starts with the belief in the gods, in other words, in a metaphysical universe, but then becomes part of your guts. And then it becomes second nature to you. And I think this is how it works. In other words, the teaching becomes ingrained, the spiritual vision becomes ingrained, and this answers the question just now. It becomes part of you. You act accordingly. What I'd like to highlight in particular, and I think this goes to the question of in what way is a religiously informed practice of compassion different from a non-religious, is the sense that Gilbert put forth of instrumentality. He knows he's not the actor. He knows he's acting on behalf of something greater. Now, it's true that our recent, the last contributor said, healthy people are healthy citizens. In other words, she's also operating on behalf of a higher ideal, which is nationhood. But that's not the same as the sense of instrumentality of the person practicing, who knows that he or she are an instrument. And that sense of instrumentality requires the surrender of self, so that you know that yourself is part of something larger and you're acting on behalf of that. And I believe that's what religion has to offer. And therefore, I'm very grateful to the two people who followed me in their video contributions, because they really illustrated very beautifully what I was trying to say. Thank you.
Thank you, Alon. Anyone else would like to respond to that? Gilbert, your name has been invoked several times now. Would you like to have the floor for a minute? If you do, please unmute yourself, and if you can, turn your video on.
Just a second. You didn't mute. It was muted.
I think you're unmuted, Gilbert. Could you speak up a little bit, please?
Oh, okay.
Good.
I wasn't too sure whether I was being invited to speak.
Yes, you
or
are.
actually made a mistake and asked me to unmute. Thank you all,
yes.
and a good afternoon to everybody. Yes. So Ashley, what would you like me to say?
We're wondering if you could respond, if you were able to hear Rabbi Goshen Gottstein's last comment about your answering to, in a sense, a higher power, your sense of how your in a sense your metaphysical view that's informed by
Instrumentality,
religion.
being an agent for something greater than
That's
yourself.
right. That's right. Thank you, Alon. Yeah.
Right. For some, faith is not an abstract concept. Mm-hmm. It's a reality we live, and it's a reality we make an effort to see in our everyday lives. So, and we do have those other experiences, even though, fine, I'm a medical doctor, the science is strong, but in my own life experiences, not everything is explained away by science. That is one. The second thing for me in the real life situation is that the faith consideration gives me a sense of purpose over and beyond the science. There are the intangibles in the spectrum of behaviors and attitudes of people, and especially of our clients, which if one had to, I mean, the patient says, you didn't smile at me, and I could be very technical and say, what has smiling got to do with treatment? Take your medicine. If I smile at you, it's very subjective what it does, but it helps me to appreciate, treat others like yourself, see God in everybody who comes your way. And this may be the angel that I may be seeing and I don't know. So there is a motivation to do what is right as my heart and my gut tells me, not necessarily as the books tell me. And I think that is the humanness we all share. I know it's a very touchy area, issues of faith, people have their rights and what people believe. But I think for me, that's what gives me grounding to do what is proper and appropriate for my fellow human being. And that is the common humanness we share. So there's no wishy-washy about it. I would love to be hugged and I will hug somebody. And if you say, no, that's not a big deal. I would love to be smiled at and cajoled and pampered, And I will do the same for you if I have the opportunity. And it has nothing to do with, I need something from you or I need a thank you, but it has to do with, my God loved me unconditionally. I have no reason not to give back what has been given freely to me. And that for me, and I think for most people who are strongly grounded in faith, it's totally over and above the science of the practice. Over.
Thank you very much. Thank you. I'd like to invite you, Shams, if you have a question or you'd like to make a comment, please jump in.
Thanks so much, David. It's been a fascinating listening to all of those perspectives, and they're so rich and they're so diverse, but they're all interrelated. So couple of the questions that have been coming up from the chat box that I'd like to sort of build on a little bit. One has been focused in on, we recognize the depth of experience, but these are experiences. How can we scale up from these experiences of compassion driving optimal health services? How can we scale that up for health for all? Big question that might warrant a little bit of a reflection from colleagues, and particularly maybe hearing from Anthea and Lolita, but also hearing from Gilbert on that one would be very helpful. Particularly, you've got facilities, hospitals that are focusing on compassion. How can we scale that up into a system? Difficult one, but maybe if I can turn to Gilbert first and then Anthea and Lolita.
I mean, thank you, Shams. Thank you, Shams, for that. I just said I'm seeing the faces. Let me let you know what I look like. Shams sees my face every day. So hello, everybody. I'm Gilbert.
It's good to see your face, Gilbert. Yeah.
Thank you, David. Thank you, David. You know, the issues you've raised still in the compassion space and in the faith space has to do with other principles of solidarity and subsidiarity. And it's not compassion in and of itself. So I have a responsibility in solidarity to seek the interests of others and do what I can for them. That's what my faith supports me to do. Then there's the issue of subsidiarity. I have a responsibility to recognize and respect you for who you are, what you are, where you are, and allow you to do the best you can for yourself and not override your own needs to look after yourself. So we have a saying in our country that you cannot mourn more than the widow. It's a fallacy to believe that we care more for our patients than they care for themselves. So if that is the premise of the positioning of compassion and what we do, that we are so interested and concerned for our patients, then we get a sense of entitlement that I'm doing this for you, and that totally derails the fundamental concept of compassion in the space. So if I can respect you for who you are and what you are and where you are, and not hold it against you or judgmental in any way, I am immediately enjoined to support you what I am capable of. The question of equity comes aboard again by faith, that, hey, everything is for everybody. I live by the day. If tomorrow does not come, of what good is all I'm amassing, especially my skill set. Everything we have is the gift through in really no effort of ours. I mean, if you're a brilliant chap, you had nothing to do with it. You were born brilliant. I mean, done. And whatever environment you were in had nothing to do with you, but your parents and other people. Faith lets me appreciate that these are gifts that I have been given, and I am enjoying to give it back. So you have issues of equity for health for all, which is not a favor we're doing to anybody, but it's a calling because of who we are in faith. And if we do not put a human face to these concepts, but we put it out as theory and we try to push it from a logical perspective, it loses the humanness that we need to institutionalize compassion. Then it becomes a subject matter. It becomes, what people think. We need to let people realize that by default, we are human. And there's a humanness which cuts across all of us from whatever part of the world and different socioeconomic groupings. And that cannot be presented in a hard and fast academic way. We need to be soft about it. We need to be wishy-washy about it. We need people to become emotive about it. People should be able to reflect and cry about it if that's how they feel, and it should be okay. But if we do not allow us to be humane, then it becomes difficult to institutionalize and transcend geography, transcend race, transcend country barriers, because our commonness is we're all human beings. And that, for me, is how we scale it up in health for all in all the dimensions. Can we who speak this be totally human about it? Can we speak with emotion? Can we shed a tear if what we're talking about hits us, and not be shy that this is not appropriate? And that, for me, is the challenge in scaling up compassion, ethics, equity in healthcare. We're still too rigid about it. It's a soft issue. It's a heart issue. And we need to find a way to communicate it that way. Over, Shams.
Thank you very much, Gilbert. So clearly advocating for essentially humane health systems. Thank you. Let's turn to Anthea and Lolita for their reflections.
Thank you. From our perspective in Australia, we have this fantastic large Catholic organisation, but our workforce is not necessarily Catholic. So for us to scale up and talk about culture, it really is about talking about the language and making the vision, the mission and the values very visible all of the time. We talk about it, we celebrate them, we see them everywhere in our facilities. But then what we would do in our organisation, we talk about formation. So we give every single caregiver the opportunity to learn about our heritage, our values, the story of Jesus, the Good Samaritan, the Catholic social teachings, as you were talking about, human dignity, the common good, solidarity, subsidiarity. All of that is really embedded in our organisation through formation. And it's a mandatory thing that we do. But then it comes down, I think, as well to vocation, because you, as a human person or as a human caregiver, you are seeking out to give care to other human beings and seeing their dignity. We talk a lot about dignity of humans. And I think if you, in Australia anyway, and I don't know that this extends to Timor, because I don't know that there is the choice in Timor that we have around our vocation and choosing our vocation, but generally in our hospitals or in our services, we wouldn't be there if our own personal values and our own personal vocation did not align with the caregiving that we wanted to give and the dignity that we see in every human. And I think Lolita made a really interesting point. It's not easy to be compassionate all the time. You're tired, you're overworked, you know, you're having a bad day yourself. But coming back to your faith, I think, and your own spirituality and your own commitment, which is another word that we talk about, your commitment to making that patient have their dignity and have the care that they need and deserve in every occasion. We talk about every moment, every occasion, being that opportunity to serve Christ and see the patient as Christ.
Thank you, Anthea. Let's come to Lolita for any quick reflections from her side.
Okay, thank you. About the question, how we expand compassion into the system. I think I already present in my presentation. The first one, because our hospital already have values hospital for excellent in service, compassion, knowledge, and commitment. From there, we put in our code of conduct. About the compassion, we put all attitude, nursing and midwife attitude based on code of conduct. And as I say for you, we already socialize. We already talking about that in all meeting in our hospital, to our nurse and midwife understand the compassion, what compassion we mean. And we all nurse in here, just one idea and one attitude, how to implement the code of conduct.
That's great, Lolita. Thank you so much, because there's so much to unpack from that experience within the National Hospital, and it will certainly have a huge effect on all of the hospitals within Timor-Leste. So thank you for that. Alon, before I hand back to David, one question for you. This subject matter on how faith cultivates compassion and its linkage to health services, it's a sensitive subject. Given your depth of experience in the subject matter of faith and the linkage with compassion, is it something that we should just leave personal, or is it something that we should actively explore? Alon.
Oh, I'd rather draw on the shallowness of my experience. That way I don't have to give a correct answer. I think you have to judge this country by country, community by community. Things may not be received in the same way in the USA as they are in France with its laïcité, and Asia will have a different way of approaching this. I think no matter what, and I think this is the key, it should not be something forced upon people, and it should be something that in the current environment should be multi-religious rather than the voice of one religion. I think in terms of scalability, this is the name of the game. Religion is all about scalability, right? One person had an experience or had an insight, and religion is there to scale it further to others. That's what it's all about. But how to do that in a neutral environment without fear of mission or fear of, trampling social norms, that has to be assessed wisely, context by context. But more than anything, putting it forth as a resource, teaching, and then for people to pick it up. And I think what we do at Elijah is we do things interreligiously. So we bring the voices of different traditions on a particular. People will either be enriched by the totality of it, or they will be invited to deepen their own experience in their own faith tradition. End of my superficial reflections.
No, please, thank you so much, Alon. So it's been a fascinating discussion. These areas will never be done justice in a 90-minute session, but it's been a fascinating discussion. I've learned a huge amount. David, back to you.
Thank you very much, Shams. And I would like to just close with some observation that we've explored both sort of the metaphysical grounding as well as the embodiment of compassion. And I think both at the individual level and in an organization or a system. And one of the lessons that comes through to me loud and clear is that this whole idea of quality health services, compassionate global health, is not just about an external project that we work on, as we do with so many of our global health projects or maybe our clinical techniques, but it rather also involves inner work. It involves the transformation of the self as well as the system. And we need to be attending to both, or we can't achieve compassionate care for all. So I really appreciate the complexity of the issue and all of the various contributions that all of our presenters have made. I also want to acknowledge the excellent questions and comments that we've gotten in the chat. Once again, we could continue on for another few hours to explore them, and I apologize to those of you who sent in some questions that we've not been able to address. We are collating these and hope to address them at least in written format in future newsletters or in future webinars as well. So on behalf of Shams and myself, WHO and the Task Force for Global Health. I want to thank our marvelous presenters, Alon, Goshen, Gottstein, our wonderful panelists on video, Gilbert and Babar, and Anthea and Lolita. Thank you so much for your contributions. I also want to acknowledge my colleague, Ashley Graham, who's put a lot of work into bringing all of this together and is behind the scenes making it all work from a technical perspective. So thank you very much, all of you. Shams, if you have one final comment, the floor is yours. Otherwise, I would express gratitude for everyone, and we look forward to being in touch with you. We will have a report of the meeting, which we will disseminate widely, and we look forward to continuing this conversation. Thank you so much. Lolita, thank you so much. Gilbert, thank you. This was wonderful.
Welcome. Totally my pleasure, being. Thank you, Ashley.
Thanks to everyone. I really appreciated learning from everyone.
Thank you, Alon. That was wonderful. Yeah.
Thank you, everyone.
Great job.
Bye.
Thank
Okay, Shams.
you.
Bye-bye. Bye-bye.
Bye, all.
Bye. Bye.
Leave me.